This is Abia COVID-19 update.
Abia COVID-19 update.
Social distancing involves non-physical greetings. Avoid handshaking or hugs. Maintaining at least 2 meters. That's about 6 feet. Physical distance between yourself and individuals, and closure of activities that will cause any form of gathering, including schools, sporting, and social events. Now, one will be asking, how is this COVID-19 spread? Droplets, that's respiratory secretions from when you cough or sneeze produced from an infected person. It can cause this transmission of the virus, particularly when there is close contact less than 2 meters with an infected person. And the risk increases the longer someone has close contact with an infected person. There are 2 routes by which people could become infected. Now, secretions can be directly transferred into the mouths or noses of people who are nearby, that's less than 2 meters, and by touching a surface or object such as a doorknob that has been contaminated with respiratory secretions, and then touching your own mouth, nose, or eye. So one of the reasons we keep advising that you should, keep washing your hands regularly with soap and water, using your hand sanitizers, alcohol-based hand sanitizers, also very important. Welcome to the program. It is Abia State COVID-19 update, the 3rd edition for the week. My name is Michael Oni. And now on this program, we highlight daily reports of the Interministerial Committee on the Control of COVID-19, as well as the Abia State Governor, Okezie Ikpeazu's efforts in ensuring that the state is safe from the virus. The program is running simultaneously every weekday, Mondays through Fridays on several radio stations in the state. On BCA FM, that's 88.1 FM, Flow 94.9 FM, Vision Africa Radio 104.1 FM, all in Umuahia, the capital of Abia State. We're also live on Bars 89.7 FM and Real 99.1 FM, both in Aba, the commercial capital of the state. Now let's do the figures. As of 8 a.m. today, Wednesday, May 27, 2020, globally, there are 5,689,212 infections of coronavirus that have been recorded, leading to the deaths of 352,294 people. And of course, 2,432,271 people have recovered. That's the global figure. Now let's talk about Nigeria. The Nigeria Center for Disease Control yesterday announced 276 new cases of COVID-19, bringing the new tally of the confirmed cases in the country to 8,344. Nigeria also recorded one of the highest daily death figures since the beginning of this outbreak, as 16 people were reported to have died from the virus, bringing the death figure to 249. So far, Nigeria has tested 46,803 samples with 8,344 confirmed cases, with 5,708 active cases, of which 2,385 infected people have recovered from the recovered and discharged from the virus, with 249 deaths. So those are the figures. As much as we additional these figures, it is not to scare you, because coronavirus is not death sentence, but to inform you to continue to stay safe, try as much as possible to stay safe. Now, just yesterday, Abia State recorded 1 new case of coronavirus in the state, and of course we got report that 2 more persons have been discharged for this virus, but we will get to know much more about that this morning on the program, Abia State COVID-19 update. And of course, you have to know, we want to know the travel history and some other issues concerning COVID-19 in Abia State. We'll take a breather now. When we return, we'll go straight into the discussion for today.
This is Abia COVID-19 update.
Abia COVID-19 update.
Well, it is still Abia State COVID-19 update live on BCA 88.1 FM, Flow 94.9 FM, Vision Africa Radio 104.1 FM, Buzz 89.7 FM, and Real 99.1 FM. Well, we'll have joining us this morning on the program the Honorable Commissioner for Information, Chief John Okiyikalu. Good morning to you, Honorable Commissioner.
Good morning, Mike. Good morning, wonderful people of Abia State.
All right, and my condolences to the state government on the loss of one of the State Executive Council members, talking about the Commissioner for Environment.
Thank you very much, Mike. And it's sad and unfortunate, but to God be the glory. The Bible says, in all things we should give thanks to God. But surely we will miss Dr. Solomon Ogunji, his vivacity, a man full of life, a man who makes common sense presentations at ESCO meetings, a man who is passionate about every assignment given to him, a field person rather than an office person, a lover of people, a lover of God, a major ally and friend of Governor Kezi Bazo. We will surely miss him, but we are aware that angels have gained him.
All right, thank you very much. Now, let's talk about the new case that was reported by the health agency that's talking about the Nigeria Center for Disease Control yesterday. It came as a surprise. Before now, when there is a new case, it is first been reported first by the government, from the governor. Then NCDC will go ahead and update their figures. But now this is coming from the NCDC directly. One new case reported yesterday.
As you are aware, the governor has been in mourning. It is not as if we are not aware, or we were not aware earlier. But the mood within the state ESCO is that of mourning. So when the news came, we did what we had to do, which was to identify this individual. He's currently in isolation at Amachara as we speak. Commence contact tracing, including his close contacts, friends, professional colleagues, and the rest of it. In due course, the governor will speak and give details concerning this particular patient. He showed up at a medical facility in Abia, where he was receiving treatment for an existing ailment. And in the course of sampling and testing, we found out that he is COVID-19 positive. We are hopeful that he will be nursed back to good health. The good news remains that two of those, myself and Samson, met at Amachara, have now been discharged.
Oh, interesting.
They have been discharged. So we have 5 active cases as at today, including one of the index patients. She's still at FMC, but she's stable, clinically speaking. The remaining 4 at Amachara, they are all clinically stable. And on the whole, we've had 8 confirmed cases, 3 discharged patients, and we are hopeful that no Abian will be lost to COVID-19. God is indeed faithful to us as a people. We have also worked hard as a government led by Dr. Okezie Victor Ikpeazu to provide what our people need to have a fighting chance of recovery, and a quick one at that. We are expecting more results, and as soon as they come in, we will inform the people of Abia State. But the most important thing is that we want to ask our people to take personal responsibility for their own protection. Don't wait for government to chase you from pillar to post to say you should not enter more than 2 in a
Okay, before we go into those precautionary measures, Honorable Commissioner, we are concerned about the cases, the rise in the COVID-19 cases in Imo State, which is a neighboring state to Abia State. So we need to be very, very careful at this time. So we want to know the situation report concerning the interstate lockdown as far as the Imo State and Abia State is concerned.
Well, the situation that we read about in Imo State is worrisome.
23 new cases in a day.
Is worrisome, but it is not unexpected. The truth is that the more you test, the more the chances of finding COVID-19 patients. The initial situation was that the case definition was quite stringent.
Okay.
If you had presented like the patient that has gone into isolation now, 3 weeks from now he wouldn't have been tested because he has no travel history, no known contact with any of the confirmed cases in the state. So ordinarily, if it was with the old case definition, he wouldn't have been tested. So what I see in Imo State is that the frequency of tests have gone up. I won't be surprised, even in Abia State, without our own molecular lab yet in place. We've ramped up testing. And with the ramping up of testing, we expect to see a lot more negative results in Jesus' name.
Amen.
But if the other one comes, we are ready. We have our isolation facilities ready. We have our management facilities ready. We think that with the grace of God abundantly available to the good people of Abia State, that no life will be lost, that everyone will be nursed back to good health. Regarding border closure, I continue to see it first and foremost as the responsibility of the federal government. The reason being that there is a presidential declaration and resolution on that. The instrument of enforcement, the instrument of law enforcement rests vividly in the hands of the federal government, and the first responsibility should be that of the federal government to make sure that the directive of the president is obeyed strictly across all interstate borders. On our own, we are doing our best to make sure that the flow is cut off, but there are challenges. That is why we are telling our people, please stay at home. If there is a vehicle moving from Imo or coming into Imo and going elsewhere, and you are able to isolate 23 positive cases, it speaks to something frightening. Our people should be worried.
We're also worried. Yesterday's show was dedicated to get the reporter's angle on what is happening on the streets. Especially, we got reporters from Abia and also Umuahia, and the reports we gathered wasn't encouraging.
Yeah, it shouldn't be encouraging, because it appears as if our people are not taking this thing very serious, and I am afraid that we might engage too late. From the dashboard I'm looking at, in my capacity as Commissioner for Information, it's not looking good. I'm not a scaremonger, but if I say it's not looking good, it is really not looking good. And we're about to enter the predicted heavy...
The peak of the curve.
Peak.
Okay.
June, July, August. We are going to see a lot of numbers rolling in across the country. Unless at the individual level, we are able to do something now, the picture I see is not a glorious one.
So let's talk about those precautionary measures again. We keep saying it, but some persons are being deceived anyways that the coronavirus is not real. But that will not stop us here to keep begging you to stay safe, for yourself and your neighbor. So the precautionary measures again.
Mike, nobody is being deceived. Whoever is not doing the right thing is the one endangering himself. That person is attempting suicide. Because look, if you don't believe there is COVID-19 and you go down and you are quarantined or isolated at Amachara, you will be there alone. At best, you probably would have infected your spouse and your spouse will join you. On the other side, female, male ward. God forbid that your children will join. The God of Abia will protect your children for us. It is, you have yourself to blame, because within that period, you won't be free to go and do your normal business. And it is because of your own negligence. See, wear face mask. Am I supposed to, or is the government in this case supposed to police people to tell them to wear their face mask properly? Are we still supposed to be talking about social distance? Is there anybody in Abia State who has not heard about coronavirus? Is there anybody in this state who is not aware that you should not enter any commercial vehicle where there is somebody that is not wearing face mask properly? That you should not enter keke that is already carrying 2 passengers, or that the driver is not wearing face mask? People are aware. But if you for any reason choose to be negligent, Ometraburu will apply. I hope you know what is Ometraburu.
I will ask something later.
Please ask him. Our people in Abia State, they know what is Ometraburu. But one thing we will do as a responsible government is, Imeta, we will still deploy your own resources, which is the resources of the state, to ensure that you are nursed back to good health. Let me say this thing. We do not charge any fee for taking care of our COVID-19 patients. There is no reason to run away and engage in self-help. There is also no reason to stigmatize anyone for being infected. No Abian invented COVID-19. I don't know if you understand that. No Abian committed adultery and got COVID-19. It is not transmitted via adultery. So there's nothing to be ashamed of. It beats me why otherwise educated people will find it difficult to call in and report that they are experiencing symptoms, or somebody known to them is experiencing COVID-19 like symptoms, when they know that all you need to do is to come in, be tested, and if positive, treated, and then you return back to your life.
All right, let's get reactions on the phone lines this morning. It's 0808 182 6949 or 0811 605 2949. You can also drop messages on 0906 510 8289. It is Abia State COVID-19 update. Hello, good morning to you.
Good morning.
Yes, good morning. What's your name?
My name is Owakwe Chidebere. Good morning, Honorable Commissioner of Information.
Good morning, Owakwe.
Like I will always say, if you doubt there is no COVID-19 in Abia, go to that Amateur Isolation Center, go and have fellowship with those that are there already. Moreover, somebody will always call and say, how did the last number came in? Did he flew from America or whatever? And I say, if you want to die with your ignorance, no problem. For me and my household, we all know that there is COVID-19 in Abia. But whether they will recover, I am rest assured that they will recover.
Please, are you staying safe?
I am overstaying safe. Once I come back home, knock at my gate, my daughter will come and open the gate and ask me, Daddy, go and wash your hands. I'm telling you, I'm not joking.
All right.
I'm not saying it for anybody to, clap for me.
Thank you for your contribution.
I've been able to sensitize them to that level. Thank you.
Thank you. Hello, good morning to you.
Hello, good morning.
You're welcome.
Honorable Commissioner, good morning, sir.
Good morning.
I'm thanking you for good work you are doing in Abia State. May God of Almighty bless you now. My name is Stanley. I'm calling from Omahia. I had a question I want to ask Honorable Commissioner. Please, this COVID-19, the medicine they will use to cure you, as the medicine come out, I want to know the name. Again, what caused this coronavirus? Please, that's my question.
All right. Thank you, Stanley.
Thank you very much, Stanley. There is no definite cure for COVID-19, but there are management drugs targeted at the symptoms of COVID-19. The most important thing you need is a strong immune system to deal with it. Of course, scientifically speaking, every antigen that enters the body will over time develop antibodies to it and take it out of the system. So if your capacity to produce those relevant antibodies is at prime level, chances are that you should be able to deal with this virus. What those of them managing these patients do is principally to attack the symptoms and at the same time help you to build the immune capacity to attack. And that's just it. There is no definite cure. It's not like malaria, that if you have malaria, they will say take this anti-malaria or the rest of it.
All right.
Let me address something that somebody... Okay.
All right. Let's get more... hello, good morning to you. Hello. Hello. All right, we lost that. Hello, good morning to you.
Hello, good morning.
Yes, good morning. What's your name?
Honorable Commissioner, morning. My name is Chiledo Bilo, the about the fire shop from Wola.
You're welcome.
I want to thank the Honorable Commissioner. You did try. You see, because of I'm in opposition, I was opportunity to go with them another matter, just to let my followers, because they know me now. If I see anything bad, me I go to come. Because some people are talking that there is no patient there. That's why I have to tell myself, I follow them to go there. My brother, I see that in my eye in Arilo. Even to wear that cloth in Wahala, where they carry enter that place, you not see wear that cloth for 30 minutes. Do you know when I came out, when I come back and approach you, do you know what to answer me? Even yesterday, are you sure that they have not paid you? Are you sure that you see the people with your eyes? I'm telling you that this is serious. I saw it. You know that people are still, even some look are still out there. So people that I thought that they are graduates, so people that I thought they are listening, they are still that they are saying that
all right. Let's wrap up things here because of time.
One man and Chile don't belong with talk like. My brother, if anybody is still doubting it, that one concern, well, what did I mean? I see with my eyes.
Thank you very much for your contribution. Because of our time, I will have to let you go. Thank you very much, Honorable Commissioner, for information, for being part of the program this morning.
Thank you, Mike. Thank you.
It's very important that you keep staying safe. COVID-19 is very real, and the only way we can curtail the spread of this virus is to stay safe. We can beat COVID-19 by staying safe. Washing your hands regularly with soap and water, use your face mask, social distancing. These are the only way, the ways we can, beat COVID-19. Thank you very much. Many thanks to the partnering stations. We will be back tomorrow when we bring up another issue as far as COVID-19 is concerned in Abia State. Ensure that you keep staying safe. My name is Michael Oni.
This is Abia COVID-19 update.
Abia COVID-19 update.